Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. Americans are experiencing the worst of the COVID-19 pandemic as we see a major breakthrough with vaccines. The FDA is expected to grant final approval for a vaccine developed by Pfizer in the coming days. It will be the first vaccine to be distributed in the United States. Deaths are soaring, with more than 3,000 in a single day this week. Locally, San Diego County is likely to reach 100,000 cases this weekend. We're now 1 week into the latest stay-at-home order. The county is setting more money aside to help struggling businesses. But as Matt Hoffman reports, that might not be enough to save jobs ahead of the holidays.
New coronavirus restrictions are here for restaurants like Shank and Bone in North Park. That means no more outdoor dining, just takeout only, meaning these patios are sitting empty.
It's incredibly expensive to try and operate in this environment, even when we are open for, some sort of dine-in service outside.
North Park Beer Company owner Kelsey McNair just had this outdoor patio built off of University Avenue. Now it's just a fixture.
It was literally completed at the end of last week, and so we were only able to use it for a few days.
McNair has pivoted in other ways, expanding his wholesale beer business, and says he will comply with the new restrictions. Still, he's had to make the tough decision to cut back his staff again. And with restaurants seemingly bearing the brunt of restrictions, he's asking for help.
I don't want to fight any orders. What I really would like to see is more help from, the local, state, and federal government as far as financial relief goes.
$20 million in county grants are available right now, but before today, that was only for businesses impacted by purple tier restrictions. The County Board of Supervisors opened it up for everyone impacted by the regional stay-at-home order. That includes personal care businesses, which have to close their doors entirely.
Financially, it's awful, but we're staying afloat. And that's all I can say is that we're staying afloat right now.
Lab A salon owner Adrienne Tolentino was doing some admin work today, preparing for 3 weeks with her doors closed.
If anything, I just want to make sure my team is taken care of, because the salon will get through it for us. I know a lot of salons won't, but I just want to get through. I just hope it's 3 weeks.
Adapting is not easy, especially when cash is tight, but places like City Tacos are getting creative, adding a drive-through right off University Avenue.
It's COVID-friendly, it's touchless, it's fast, it's efficient.
Owner Gerald Torres says he's trying to bring in business while keeping the community safe.
In this tier, in this time, we don't know what to expect tomorrow. We don't know what to expect next week. We don't know if people are going to, be comfortable enough to go out for, the foreseeable future.
There's a few City Tacos locations across the county, and while Torres has had to cut his staff hours, he's trying to keep everyone on the payroll.
There's a lot of uncertainty. They worry about their futures, and as owners, as managers, we try to really take care of them and let them know what's happening and be open and upfront and try to protect them as much as we can.
All of these owners say the same thing, especially right now, spend your money locally.
I know that I see the Amazon trucks going up and down our streets all day long. It's tempting. I get it. It's so easy to sit on your couch and click and buy. But every time you do that, you're taking money out of the pockets of our small businesses.
Matt Hoffman, KPBS News.
There is some hope when it comes to finally reaching an end to the pandemic. Coming up, we'll take a look at the progress toward a vaccine and how it will be distributed locally. Who will be the first in line? That story is coming up a bit later in this newscast. San Diego has a change in leadership at the peak of the COVID-19 crisis. Mayor Todd Gloria was sworn in Thursday and had this to say about the challenge facing the city.
So over the next 100 days, we will dispense with the small issues that past leaders have struggled to resolve so that we can focus on the biggest problems facing our city. We will be rolling out an aggressive strategy to address the worsening public health crisis in COVID-19, the economic crisis that is impacting San Diego's families, small businesses, and our city budget, the housing and homelessness crisis that has become even more dire. My team and I are moving swiftly and decisively to protect our most vulnerable. And we'll do it with the long-term goal of building a more resilient city in the process. It's not enough to get things back to normal. Normal wasn't and won't be good enough. If we dream big, work together, and believe in San Diego, we can accomplish anything. We will change the narrative, not just for the privileged few, but for everyone, especially those who have traditionally felt unheard.
Mayor Todd Gloria will have strong political backing at City Hall. During Thursday's inauguration, 5 new city council members were sworn into office. Democrats now hold 8 of the 9 seats. Councilwoman Jennifer Campbell will serve as city council president. A smartphone app that will alert you if you've spent time near someone who tests positive for coronavirus is now available. The free app, which was first used at UC San Diego, is now available for Apple and Android devices. It's called CA Notify. State officials say the tool doesn't track people's identities or locations, but uses Bluetooth wireless signals to detect when 2 phones are within 6 feet of each other for at least 15 minutes. The county is now requiring an appointment at its free testing sites. We've seen long lines in recent weeks, and this is an attempt to reduce the crowds. Coronavirus-SD.com has more information. People can also call 211 to get help by phone. Stater Brothers Markets is once again giving employees hazard pay as COVID-19 cases are at their highest peak since the pandemic started. KPBS North County reporter Jacob Ayer says a grocery workers union is working to get other stores to do the same.
The United Food and Commercial Workers International Union, or UFCW, came to an agreement with Stater Brothers Markets to reinstate the company's $2 per hour hazard pay. It applies to all 18,000 hourly employees in its store, distribution, transportation, and construction operations and corporate offices across California for at least 3 weeks from the work periods that started December 6th and 7th. In a company statement last Friday, Stater Brothers CEO Pete Van Helden said, "I continue to be proud of our employees who display their extraordinary dedication every single day, and this wage incentive is but a small token of our company's appreciation of their efforts." At the beginning of the pandemic, Stater Brothers was like many other grocery companies who instituted hazard pay. The organization ended up extending their benefits 5 times to run through June 14th. But during the current wave of rising COVID-19 infections, they find themselves in the minority of grocery stores to give bonus pay to their employees.
Kroger, which is Ralph's Food for Less, they are not doing it. They were the first company to pull out from doing it. We've asked them continually to please reinstate the hazard pay. Albertsons Vons has given their workers a bonus, basically a $5 an hour bonus averaged over a week's worth of pay, which is something. It's something, and I recognize that, but they can do more too.
A grocery outlet that is giving additional pay to employees is Trader Joe's, which is not part of the UFCW. In an email to KPBS, the company said they are continuing to provide an additional $2 for every hour worked. The thank you pay will remain in place until at least March 31st, 2021, or until we're no longer considered an essential business. The UFCW represents workers at some of the nation's largest grocery store chains like Albertsons, Ralph's, and Vons. It said that among their members, there have been at least 109 grocery store worker deaths and over 17,400 infections or exposures to COVID-19 since the onset of the pandemic.
We've had members who've been quarantined numerous times. They don't have any sick leave left. The lack of sick leave, lack of paid leave is encouraging or forcing somebody to choose, do I go to work and put food on the table, or do I stay home, which is the right thing to do, and not infect other workers?
The UFCW union is demanding that retailers and grocery companies also provide free personal protective equipment and COVID-19 tests to all employees. Jacob Ayer, KPBS News.
The COVID-19 vaccine could arrive in San Diego County by next week. CVS Health is looking to hire more than 100 pharmacy workers to help deliver those first doses. KPBS reporter Matt Hoffman says the county is working with employers to move the most at risk to the front of the line.
Initial vaccine distributions will be focused on healthcare workers. Specifically, county health officials say those in acute care, psychiatric, and correctional facility hospitals.
We're limited by the amount of vaccine that we receive from the county.
Sharp Healthcare is one of the local hospital systems expecting first doses of the vaccine. County officials say they've ordered around 28,000 doses. Sharp isn't exactly sure how many they're going to get yet, but they will be going to people working in emergency departments and
our ICUs, urgent care areas, the folks who are most at risk.
Sharp officials say they have thousands of frontline workers in San Diego County eligible for first vaccinations.
We will get the communication out to our employees and have them schedule themselves, so it's not mandatory, up to the extent that we have enough vaccine.
Many other local hospital systems, including Rady Children's, Scripps Healthcare, Palomar Health, and UC San Diego Health, are finalizing vaccine plans for frontline workers. The vaccine is 2 doses, just like the hepatitis A shot, and officials say for now it's not a replacement for wearing masks or social distancing.
We do not know well how long the immunity lasts. And for that reason, too, we're encouraging people who have had COVID-19 to also get vaccinated. We're still learning a lot about this virus.
It could take more than a month to vaccinate all frontline healthcare workers. After that, doses will be prioritized for those in assisted living facilities and first responders. Health officials have said it could take until March or April for vaccines to be available for all Americans. Matt Hoffman, KPBS News.
A new report finds veterans are struggling to file claims for VA benefits during the pandemic. KPBS military reporter Steve Walsh says many vets are being improperly denied because they cannot get to a doctor.
Mark Session got a late start. He was 34 years old when he entered Navy boot camp. Like many vets, he has lingering issues from his time in the service, especially with his back. He's been wrestling with the VA benefits process since he retired in 2017. This year, during the pandemic, the real issue for the Chula Vista vet has been getting in to see a doctor.
I initially scheduled in February, and then it was rescheduled to September, and then September to October, and then October they finally got a schedule for November.
Even in a normal year, Sessions says the VA claims process is long and exhausting.
It's very frustrating because I want this whole situation to be over, to finally not have to be worried about any more exams or having to, contact my attorney and stuff like that. It's just want to be done with it and get it out of the way. And
beginning in April, the VA shut down all in-person appointments. Everything moved online, including doctor's appointments. The backlog of exams ballooned to 1.5 million during the pandemic. A new report by the VA's Inspector General also says thousands of claims were improperly denied. This after VA leadership declared that no vet should have their claim denied because it wasn't safe to see a doctor. Sessions attorney Casey Walker once worked for the VA. As he puts it, some VA employees just didn't get the memo.
And then you got to keep in mind, at the same time, a lot of these employees work from home for the first time ever. Many of them not being too capable with their technology from home. They've always worked at the regional office their entire lives.
VA may require an in-person examination as part of the claim process.
The VA made the backlog worse, Walker says, by telling outside mental health providers that they could not evaluate their patients remotely when it came to filling out VA benefit claims. At the same time, the VA was telling its own doctors and contractors to only see patients using telehealth.
Then almost in the same month, they said you must do all mental health exams by telehealth means. And I thought, well, what gives here?
The VA's website shows nearly all of the country is open for in-person exams to some degree to chip away at the backlog of 1.5 million exams. Maura Clancy handles veterans benefits appeals for Chisholm & Kilpatrick, a national firm based in Rhode Island, which has clients in San Diego.
I have noticed more examination reports coming in. So I know that they are working on the exams that were pending throughout the pandemic. And so that's a start.
Instead of scheduling new visits, she says the VA should also lean more heavily on using existing medical records, at least for now. The VA told their Inspector General that they are looking at cases denied during the pandemic. Vets shouldn't count on their cases being reopened, Clancy says. Instead, vets should assume they'll have to step up on their own and file an appeal.
It only helps the case, I think, to be able to point to what VA's guidance was in the beginning of the pandemic, which was that those denials weren't supposed to happen. And hopefully that they will take some corrective action.
The VA has been trying to clear away the backlog of benefits claims for years. A new law went into effect a year before the pandemic designed to speed up the process. According to advocates who helped guide veterans through the process, juggling the new system and a pandemic probably created more cracks in the system. Steve Walsh, KPBS News.
Students at San Diego State University now have an idea of when things might get back to normal. The CSU system plans to return to mostly in-person classes starting next fall. When it comes to spring semester, there will be some limited in-person courses at SDSU. However, students will need to be tested before returning to campus. SDSU is also delaying the start of those classes by 2 weeks to give enough time for proper testing. As end-of-semester grades and test scores start to roll in, it's becoming clear that the pandemic is taking a serious toll on student performance. KPBS education reporter Joe Hong explains what educators in San Diego County are doing to address the higher rates of failing grades this year.
For my classes right now, the grades they're not wonderful. They don't look great.
In normal years, English teacher Damien Patterson says he has about 5 or 6 students with D's and F's. But this year, among his 37 students at Grossmont High School in El Cajon, 12 students have F's. He said learning from home has come with obvious challenges.
It's hard to focus when you're surrounded by, you're in your bedroom, it's comfortable, you have your bed there, your TV, the PlayStation or whatever, your phone.
But he says that's only a part of the problem. Some of his students have shouldered burdens beyond their schoolwork since the pandemic hit.
Some of them have jobs that they're working. They are taking care of siblings while their parents are working or going to school.
These issues are not unique to Grossmont High or even San Diego County. Schools across the country have reported more D's and F's since COVID-19 shut down schools. It's yet another stark reminder of how hard it's been for educators to hold students accountable while being sensitive to their needs during distance learning. Teresa Kemper is the superintendent of the Grossmont Union High School District. When schools first closed in the spring, the district adopted a no-harm grading policy, and she said some students just stopped trying.
So we did want to provide more accountability. So coming into this school year, we said grades are on. You're starting the year fresh this way, so everything matters, everything counts in the classroom.
But when the district saw the uptick in failing grades, principals and counselors ramped up outreach efforts and started a credit recovery program through which students can make up missed work.
What units or what assignments did students miss that quarter that maybe after school, before school, in winter session, in December, January, they can work with teachers to make up, to go back and fix that grade.
At Poway Unified School District, about 7% of all grades are F's this year, which is nearly twice the percentages last year. David Lemaster is the Executive Director of Learning Support Services at the district. He says the most effective remedy has been bringing students back to campus, even if it's just for 1 or 2 days a week.
When we see a student who's struggling, the principal counselor will reach out and offer them the ability to come in and learn virtually on campus. And that has really helped to re-engage the student into the learning.
Lemaster said he's not too worried about long-term consequences. He's confident that teachers and counselors will be able to keep students on the right path.
I think we're early enough in the year where we can catch those students and still get them back on track and ready to go so that it doesn't affect the numbers of kids graduating and or getting into the colleges that they want to get into.
Back in Grossmont, Patterson says this year has proven that there is no real substitute for an in-person classroom.
Students just tend to do better in the environment inside of a classroom where they're in front of a teacher and they're kind of held accountable, and they have teachers and different ones to check in on them and make sure that they're on task and things like that.
Joe Hong, KPBS News.
We're kicking off an ongoing series of pandemic profiles highlighting San Diegans surviving, hurting, or thriving during COVID-19. KPBS reporter Max Rivlin-Nadler brings us the story of Ali Hanamo, an immigrant and restaurant owner in City Heights.
27-year-old Ganamo Ali immigrated to City Heights from Ethiopia when he was 11. Since then, he's been rooted in the community and studying marketing at SDSU. When he began looking into opening his own restaurant last year, audaciously combining Ethiopian, Thai, and American menus, he knew he wanted it to serve the community he's long called home.
I feel like, my home, which is City Heights, deserves better, deserves some option. So I put everything I have, everything I know about food into creating this menu.
But the pandemic put a damper on his dreams of opening a restaurant. So Ali began experimenting on recipes at home.
I started posting the food that I make on Instagram. And from there, people really liked, my food. And I started selling out and stuff. And that's when I noticed, I got to take this to the next level again.
Soon, Ali had come up with what he called the ghost restaurant idea. For 6 months, he rented a kitchen, got the necessary permits, and operated a restaurant specifically geared towards the pandemic.
We put up the menu online and everything. People order through Uber Eats, all those third-party deliveries. They come pick it up or it gets delivered.
Business was good. Ali wanted to keep growing. Stuck at his apartment on Fairmount Avenue, he began looking across the street at unused kitchen space at Donut Star. After months of negotiating, Ali's Chicken and Waffles opened on October 17th.
I invited just close friends and family to come through, but we sold out on the first day.
With other restaurants closing, business for Ali has been good. But he still hopes to open a dine-in brunch destination whenever it's safe to do so. Max Nadler, KPBS News.
The pandemic has brought so many changes to how we live our lives. Among the most difficult, how people of faith worship and celebrate without being able to gather in the ways they did before. With Hanukkah underway, KPBS reporter John Carroll shows us how one rabbi is leading his people through uncharted waters.
As soon as the pandemic hit in March, Rabbi Yerucham Eilfert knew the way he'd done things for years would have to be different at the synagogue he leads, Chabad at La Costa in Carlsbad.
People are going to need our support, and we're going to have to change how we offer that.
Pre-pandemic, everything that happened here centered around this building. Rabbi Eilfert, or Rabbi E, as most people call him, gathered with fellow rabbis and lay leaders to chart a new path to deliver an ancient message.
And people are going to need the strength, the inspiration that they get from the teachings of the Torah, from the Jewish Bible, from Judaism, more than ever before. So how do we bring it to them?
That meant thinking out of the box.
In a bit of holiday irony, thinking outside the box here at Chabad at La Costa has meant using actual boxes. This year, they're delivering Hanukkah in a box.
This is the menorah. This is what we light on Hanukkah.
The boxes also contain dreidels and gelt. That's Yiddish for money, in this case, chocolate coins. Rabbi E says he's not taking the approach of certain houses of worship, fighting health orders, limiting how many people can gather inside. But he's wary of politicians, as he says, getting comfortable with certain regulations. It all comes down to what safety means.
Maybe I would be safer never getting into my car. Maybe I should just stay in bed all day. But that's really not safer. Follow the law by all means, but you know what, guys? We've got to move this along also. We've got to find a way, help the science forward. It's never going to be 100% safe.
Rabbi E admits the struggles of the COVID era have gotten him down from time to time. But when that happens, he says he thinks of the big picture.
I have a decision to make. Am I going to curse the darkness, or am I going to try and kindle a light?
As Hanukkah begins, the focus for Rabbi E's congregation, for Jews around the world, is light. In a metaphoric sense, the whole world looks to the light at the end of this dark tunnel, vaccines that will eventually lead to the end of the pandemic. But Rabbi E says even then, he won't forget the lessons learned during this difficult time, new ways to practice ancient traditions.
I'm going to focus on the God, be God-centered in my own life, and try and inspire other people. That's what we're going to do.
John Carroll, KPBS News.
This might be a good weekend to get outside and play. That's because Governor Gavin Newsom reversed course on last week's order to close playgrounds. KPBS Metro reporter Andrew Bowen says many parents are relieved.
Parents and kids wasted no time in taking advantage of the reopened playground at Trolley Barn Park in University Heights. When ICU capacity in Southern California fell below 15% last week, the state ordered playgrounds closed, but parents pushed back and the governor relented on Wednesday. Nicholas Estrada was glad to get out of the house with his 3-year-old daughter, Amora.
I'm a single father, so I'm trying to do the best I can to keep her engaged as well as myself. With everything going on, it's definitely been difficult. Just trying to take it day by day and wake up and find new things to explore to keep her engaged and myself.
Assemblymember Lorena Gonzalez was among several state lawmakers who wrote Governor Newsom, urging him to reconsider the playground closures. She says for parents who have a private yard, playgrounds may not seem that important.
But in communities like mine, where really you have so many people in apartments, or you have so many people without big yards or any yard, the play structure may be the only opportunity to get these young kids outside.
Marcia Lutio homeschools her kids Nalu and Phoenix. She says it's good for them to be able to interact with other kids, even if it means wearing a mask.
And it gives the kids an outlet, a really natural way for them to play and run around and get out of the house, stimulates emotional and mental and physical health, just gives them hope in general.
Andrew Bowen, KPBS News.
And that's all for this special edition of KPBS News. I'm Maya Trabulsi. For all of us here at KPBS, thanks for joining us. Stay safe.